Welcome to Vet Surgery TV. In this series, we'll review real surgical case reports together and learn from each one. Let's get started. And if you enjoy this type of content, please don't forget to like, subscribe, and hit the bell icon so you won't miss our next videos. Case report number 1. A 4-year-old female Chihuahua presents for suspected dystocia. The dog was mated twice, 67 days ago and 65 days ago. The dog has been experiencing strong contractions for the last 45 minutes. Based on ultrasonographic examination, one fetus is dead and the second has a slow heart rate. What is the reason for the inability to whelp? This dog has had previous pelvic fractures, resulting in a narrowed pelvic canal. The fetus did not pass through the canal and resulted in fetal death. The dog has fetal obstruction and secondary uterine inertia. Strong contractions for over 30 minutes without expulsion of a fetus indicates dystocia. What surgery do you recommend? A cesarean section is recommended for the remaining living pup and for removal of the deceased trapped pup. What anesthetic protocol will you use? Many anesthetic protocols have been recommended for use during cesarean section. Puppy mortality rate is reportedly lower when propofol and isoflurane are used. Regional anesthesia has been described as an alternative to general anesthesia. The use of regional anesthesia is not correlated with improved puppy survival. Therefore, a safe protocol for cesarean section includes induction with IV, propofol without pre-medication, rapid intubation, and maintenance of anesthesia at the lightest anesthetic plane possible. Because the fetal heart rate is low, atropine is administered. Atropine is chosen over glycopyrrolate because glycopyrrolate will not cross the placental barrier due to its large molecular weight and charge. Atropine can cause fetal disorientation or excitement due to its central action, but fetal effects may vary depending on the amount of drug absorbed. Case report number 2. A 1.5-year-old spayed female Bengal cat presents on emergency for respiratory distress. Thoracocentesis revealed a large amount of thick brown fluid. Microscopic evaluation findings were consistent with pyothorax. A CT was performed and a cross-sectional image is shown. In what ways can infectious agents gain access to the pleural space, causing pyothorax in dogs and cats? Microbial access to the pleural space is gained through penetrating injuries to the thoracic wall, bites, foreign bodies, airways, inhaled migrating plant material, esophagus, or iatrogenic thoracocentesis. Pyothorax may also be caused through hematogenous or lymphatic spread of infectious agents, pulmonary or intrathoracic neoplasia or abscessation. In rare cases, pyothorax has been identified as an extension of discus spondylitis or bronchopneumonia. It is important to note the route of infection is usually not identified in 86 to 96% of dogs and 33 to 60% of cats. When is surgical intervention recommended to manage pyothorax? Surgery by means of a lateral thoracotomy or median sternotomy is indicated when there is identification of a primary cause that requires surgical resection, such as foreign body lung lobe torsion, and/or a pulmonary abscess. Surgical intervention is also recommended when failure of appropriate medical management, which consists of systemic antimicrobial therapy and intermittent thoracocentesis or bilateral thoracostomy tube aspiration and/or lavage occurs. Persistence of effusion beyond 3-7 days and complications associated with a previously placed thoracostomy tube are also instances when surgery is indicated. The presence of Actinomyces species has also been reported as an indication for surgical intervention due to its high correlation with migrating grasshounds. 1. Paper reports short-term survival rates of 29%, 77%, and 92% following treatment with thoracocentesis alone, thoracostomy tube, or thoracotomy and thoracostomy tube, respectively. Case report number 3, a 4-month-old female mixed breed dog presents for a checkup and vaccination. The puppy has been urinating and defecating without difficulty. This is the perineum.
What is your diagnosis? This is an anogenital cleft and imperforate anus. In animal with anogenital cleft, the feces and urine enter a common cavity prior to exiting the body. In this dog, the ventral mucosa of the anus is continuous with the dorsal mucosa of the vagina, forming the cleft. The anal sac orifice can be thin dorsal to the anal opening. The dog also has an abnormally formed tail. What may develop as sequel to this abnormality? Urination and defecation occur without difficulty. However, fecal incontinence, preanal soiling, and irritation may occur. Because of the common vestibule shared by feces and urine, ascending urinary tract infections may occur and may lead to pyelonephritis. What treatment is recommended? Reforming the anus ventrally and then closing the soft tissue between the anus and vulva can repair an anogenital cleft.
Case report number 4, a 9-year-old spayed female Shih Tzu presents for hind limb lameness due to luxating patellas. Thoracic radiographs are shown. A grade IVVI left apical. Systolic murmur is ausculted. What is the most likely cause of the murmur in this dog? The most likely cause of the murmur is mitral regurgitation secondary to degenerative valve disease. This is the most common acquired heart disease in dogs and is very common, particularly in older, small breed dogs. The radiograph shows that the dog has left atrial and left ventricular enlargement, which occurs with volume overload due to mitral regurgitation. Discuss special considerations for sedation and anesthesia of this patient. The goals when dealing with a patient with mitral regurgitation are to avoid increases in afterload and preload, maintain contractility, avoid bradycardia, and minimize myocardial oxygen demand. Alpha-2 agonists, such as dexmedetomidine, are potent vasoconstrictors that can significantly increase afterload and therefore are contraindicated in these cases. Instead, opioids, which have minimal cardiovascular effects and low doses of acpromazine, can be used. The vasodilatory effect of acpromazine can decrease afterload and actually be beneficial for mitral regurgitation. For induction, propofol and etomidate have minimal negative effects on the cardiovascular system. While ketamine can be used in cases of mitral regurgitation, it must be used carefully as it can cause vasoconstriction as a result of sympathetic stimulation. Although inhalants for maintenance of anesthesia are cardiovascular depressants, these effects can be minimized with a balanced anesthetic protocol. Should bradycardia develop with sedation or anesthesia, anticholinergics, such as atropine or glycopyrrolate, should be given. Additionally, high rates of parenteral fluid administration and fluid boluses should be avoided, and careful monitoring of the respiratory rate before, during, and following the procedure is important. Positive inotropes with minimal alpha receptor activity, such as jugotamine, may be useful to maintain blood pressure and tissue perfusion, if necessary. What would be a contraindication for surgery? Untreated congestive heart failure is a contraindication for surgery. Cases of moderate to severe mitral regurgitation without congestive heart failure, such as the dog shown in the radiographs, are higher risk anesthetic candidates, but can often be successfully anesthetized with careful selection of anesthetic drugs. Case report number 5. A 7-year-old castrated male domestic short-haired cat presents for severe facial pruritus. The owners had recently adopted the cat as a stray that was found on their front porch. The cat was indoor-outdoor and frequently roamed the neighborhood unsupervised. They noticed that, for the few days prior to presentation, the cat had been shaking his head frequently and would often scratch at the neck. On physical examination, severe facial excoriation is present, along with a unilateral swelling of the left pinna. 5. You suspect the cat has an oral hematoma. What additional diagnostics should be performed along with treatment of the oral hematoma? Ear swabs should be collected for cytologic evaluation and to determine whether ear mites, Orthodectes cenotes, may be a complicating factor. Oral hematomas are almost always caused by uncontrolled otitis externa. Ear mites would be a likely diagnosis in an indoor-outdoor cat. However, other options may be considered, such as secondary infections with bacteria and/or yeast, underlying allergic disease, or concurrent external parasite infestation, for example, dab fleas, notoedres mites. Several surgical corrections are available for oral hematomas. Describe them. Surgical techniques involve incising over the hematoma cavity, draining excess hemorrhage, and placing full-thickness sutures at regular intervals to keep tissue layers opposed. This tends to provide the most cosmetic repair. Alternatively, a cannula may be placed in the hematoma cavity to provide drainage. Suction drains may provide similar benefits. The cannula or drain is typically left in place for several days until drainage stops. Punch biopsy technique involves making multiple drainage holes in the pinna. The biopsy sites should be left open to heal by second intention. A CO2 laser may be used in a similar fashion to punch biopsy. Tissue adherence may be improved when the laser is used. The owners have moderate financial concerns, and surgery is not an option for the cat. What alternative options may be considered? Medical treatment for oral hematomas is successful for many patients. The hematoma should be drained as much as possible. Both medial and lateral compartments of the pinna may be affected, and then a small amount, approximately 0.1 milliliters of long-acting injectable steroid, for example, triamcinolone acetonide, can be injected into each compartment. Bandaging may not be necessary or effective. Additionally, it is imperative to treat the inciting cause of otitis externa and any secondary infections that led to hematoma formation.